individuals who are real stakeholders in the community. Now, some people have done average things. That means maybe gone to medical school. Others have created a pipeline for generations of doctors in their own homes. Did you hear me? That's pipelines of doctors in their own homes. Maybe you don't understand what that means to the Black community. That means you actually have somebody that cares and created enough care and spiritual concern that he created an entire pipeline of doctors. But we'll get to that. What I want you to know is that we bring individuals who care about our community, and we are not second, we're not third, but we are the first priority in a culturally relevant way, that they are actually being not just medicine men, but literally addressing how COVID, and as most women, particularly Black women, infant mortality rates are well beyond what they should be. And if somebody loved our women in our community, we wouldn't have these issues. So, bringing you tonight, Dr. Rod J. Turner, MD, community leader, visionary. How are you? Welcome to Health IQ.
Thank you and good evening, everyone. It is my pleasure to be here to give some enlightenment to our community and the world.
We need enlightenment at this moment. Obviously, for me, Dr. Turner, it has been a challenge, because I think when I first encountered you, you gave me a KPI, key performance indicator. You said, "Hey, brother, are you?" And then you said, "It needs to be," and you gave me a number. I think our lack of numerical exchange and information is killing and robbing our community. So you said, "Hey, brother, if you want to really begin to deal with COVID," and then you gave me a prescription, one that didn't require much other than my participation in receiving your information and changing my behavior immediately, and saving my life, by the way.
Yes, sir. I think one of the main things I hear a lot about, which we need to continue doing, is wearing your mask. Wearing it over your nose and your mouth, not just your mouth. So if it does slide down by accident, put it back up so it covers the nasal opening as well as your mouth, not just your mouth. Number two, the other thing that studies have shown is if everyone took vitamin D and we all got our vitamin D levels to be at least 40 and over, COVID would not find any host if our levels were at 40 and over for 2 weeks or more and we all wore a mask. COVID would not like us as a host, and it may disappear. So separate from just wearing a mask, vitamin D needs to be taken on a daily basis, at least 5,000 international units. Sometimes you'll see 5,000 IU. I take 10,000 international units daily. Eat healthy, drink water, wash your hands frequently. You cough into your arm or your shoulder or your elbow, even if you have the mask on. It'll help prevent spreading of the virus outside of the mask. So not only you're protecting yourself, you're protecting your loved ones and people around you.
So we're in holiday, which is a huge concern. I think many people have decided that they will still try to meet with a loved one. Why is this culturally a problem?
Culturally, it's hard because that's where we get most of our sustenance from, especially within the Black families, greeting and having a family reunion. But my own personal bias is we can do it, but it needs to be safely done. If somebody is sick, coughing, fever, sore throat, difficulty breathing, or can't breathe, they need to stay home and or seek attention and get tested. Other options, get tested before you go to your in-laws' house. And if it is going to be a group of people, it's not 50, 100, but maybe 10 or less. And those 10 that are there wearing a mask, socially distancing, and hopefully everybody got tested just to be safe. And if you're all negative, it's less likely for it to be spread or present.
So those are the protocols that we all need to utilize. What else can we do to make sure that we are addressing some of the comorbidities that appear in our community? How can we change our, I have movement goals, and I like to say movement goals, but what else would you recommend that we need to really rapidly change? Because post-COVID, we're still going to have these issues, and this is the moment of change.
Yes. Obesity, high blood pressure, diabetes. We need to eat better. We need to eat healthier. For people having difficulty meeting those needs because of COVID and lack of work and lack of income, we still need to make healthy choices as much as possible. Call your social workers within your city and local state government officials. Ask for help. Don't be afraid to ask for help. Number 2, 8 to 10 glasses of water. Number 3, get up from the sofa while you're watching the evening news, Wheel of Fortune, Entertainment Tonight, whatever. Walk in place for 30 minutes consistently 6 times a week. Get it up to 45 minutes. And then the third week you're doing it, get it up to 60 minutes of continuous walking and movement, 8 to 10 glasses of water, and eating healthy. Those 3 things can be game changers for our community with diabetes, obesity, and high blood pressure. So with all that being said, it's just a matter of not if, but when we can do it. And it's easy changes that we can do as a community.
It's funny you say that we walk in place, but I also say, if you're going to be on the phone, instead of sitting down and talk, walk in a circle, walk to the kitchen and back, walk around the neighborhood, but walk and talk. Walk and talk. Do not sit and talk. If you find yourself in a long conversation, make sure it was a movement conversation where while you were talking, you are actually saving your life.
Amen. If you're in the kitchen cooking, walk in place, turn on some music and dance while you cook. Those are things that can potentially make game-changing alterations within your health profile that can be safe for us in the long term.
So why is water and hydration important for us? Because you've said it like twice in less than 10 minutes. Why is water so important?
Water is important because it's not just water, it's hydrogen and oxygen molecules that the body needs. The brain needs for appropriate synapsing, your joints need it for lubricating of your elbow, your knees, your feet, your joints, your hands. It just helps to hydrate the body with oxygen and making you feel better. It flushes your kidneys of impurities. One of the things that people need to be aware about is if you go to the restroom and you use it and you see concentrated cocoa, brown, yellow, orange urine coming out, you need to get up and go drink 6 to 8 ounces of water and keep doing that until your urine eventually clears up. Because if it's concentrated yellow, you're not getting enough water in your body and your kidneys are acting as if they're filtering dirt, but there's nothing in there to help flush out the impurities within the body.
So for all of us who are listening, it's key, at least this is what Dr. Turner is suggesting, that we monitor how our body speaks back to us. So yes. What you were suggesting is that if you don't watch the color of your urine or you assume it's supposed to be yellow, it's not.
Maybe yellow first thing in the morning when you wake up, maybe yellow within an hour or two of taking a prenatal vitamin, but throughout the day, it should eventually clear up. And if it's not clearing up and you feel like you are drinking enough water, 8 ounces per day at least, then that's when I tell people you may want to go in and see your doctor for assistance in counseling and follow the recommendations of your guided physician.
Right. So key indicators, once again, for our community: 8 glasses of water, clearly have a relationship with your physician, because I just saw you go there. Why is it important to have a relationship with a physician?
They get to know you rather than figuring out you in the emergency room. Can't speak, stroke, sugar 500, 600, coma. That's the wrong time to get to know somebody when you're in a urgent, emergent presentation. It's nice to know, hi, Mrs. So-and-so. This doesn't seem like you because things look different today. What's going on? When you get to develop a rapport with your patient, it helps you to help them understand when things might be going different. So get in your doctor now, not after the fact.
Use your insurance for all of you that have some, and even your Medicare. Make sure that you're using it at least quarterly. It is important. It is not, you're not saving it. You paid for it. Why not use it? You know, we need to make sure that we have a relationship so that somebody can advocate for you prior to, and that's advocate to us. The other thing is COVID. It struck us as though we got hit by a ton of bricks. What should we know about COVID in our homes? What can we do to kind of move ourselves away from behaviors that we had? You said wash your hands. What are the other things that we're unconsciously doing that is allowing COVID in our house?
So a lot of what's going on within the community definitely needs to be top down. Our leaders need to be able to instruct and guide and lead by example. Number two, our parents need to educate our young kids and young adults and what should be done and not done. Growing up, as my mom used to say, you can't eat food from everybody's house unless you see who's in the kitchen cooking. So with that being said, people need to make sure they wash their hands. People need to respect distances. You can be social without in people's space. So back up some, give people space. So if they do cough, okay, it's hopefully not getting to you if you're at least a good distance away from them, especially post-COVID. Wear your mask even if you're in someone's home. There's nothing wrong with that. There's a lot of decorative masks if you want to be in vogue with the latest, greatest, and look good wearing it, but you need to wear your mask, especially if you're in someone's home. Wash your hands. If they're sick, let people know you're sick before you come to their house, or don't go to someone's house if you are sick. Stay home, get tested. If we know our status, it helps us help other people and help ourselves.
Right, that's key. So you're quarantining. What type regimen would you recommend? Because many don't have 5, 3, even 2 bathrooms. We've got to protect ourselves. We're in a home. What's a great regimen that the family can come together, which we want them to be, and we're partners? How do we do that?
One of the things, whether you live in a 1-bedroom house, it's going to be hard. You live in a mansion, it makes it easier. But we still need to provide protection, personal protection equipment, PPE. And again, wear a mask. If you don't have a mask, get some sort of scarf. Use something that will cover your mouth. Good hand washing. If someone is coughing a lot, isolate them. I see on the elevators, most elevators will now allow 4 people at a time. Everybody get a corner. You stay in your corner. You clean well. You wash your hands. If you can find Lysol, you Lysol the area in question. The key thing is minimize risk of spreading the virus to your loved ones, especially those in close proximity to you.
So, moving closer to the truth for us is just culturally, we've got to adhere to those things that we know will keep us safe. Like that has to be priority number one. One of the things I say to most people is survival is the name of this game.
Yes.
It is not how you feel. It's called survival. So in order to survive, and you're saying the vitamin D, the wearing of the mask, the exercising, most people are losing it here. The mental stress. How can people cope during COVID? What are the other methodologies? Obviously, we know we get a little bit with exercise, but I think some just need some hope right now on how to manage the isolation that comes with COVID, the lack of touch that comes with COVID. How do we manage that?
Just like we're doing, Zoom, talk to people, get on the phone, call your loved ones, get back to the basics, write a letter to your mom if she's still living. Mine rest her pieces in heaven, and my dad. Write a letter to a loved one, write letters to family members, get back to the basics. Everybody doesn't have to have everything immediate and upfront in your face in order to be happy. When you're not feeling in the right place with your mental acumen, with your ability to feel right, call your pastor, call a social worker. If you feel like you want to harm yourself or harm somebody else, you need to go ask for assistance at your local emergency room or 911, because there are services out there that can assist us when needed. The question is, are we going to ask for help? And some of our community people think it's taboo to ask for help. It's not taboo. It's okay. We're here to help. We're here to provide a service so you can be a better version of yourself. And at some point you can help someone else through this crisis. But again, don't be afraid, because we're all having issues with feeling isolated. But sometimes one of the best things you can do to isolate is remember who's in charge. He has our back.
Right. So I guess we're having kids during COVID.
Yes. December and January is going to be busy.
What should we know about supporting our family members and just where pregnancy and COVID play a role? I mean, I hope we get tons of babies for this upcoming year so we can have some happy and joy and new memories for families. But what should we also know in order to support those who may not be able to get the assistance from assisted pregnancy during this moment, where they really wanted to get some assistance but can't? Those who may not be able to conceive based on moments, based on stress. What can they do? Because I don't want to assume that everyone can get pregnant, or that people who are having anxiety or having issues inside their home can get pregnant. So those are some of the things I think I hear people talking about.
For those patients who are having difficulty getting pregnant, the key thing is contact your doctor. Get the testing done. Just because they may refer you to the hospital for certain procedures in infertility workup, as long as you put your mask on and you do it safely, you wash your hands, you follow the basic PPE protocols that are in place in the state and local community areas, you should be able to get in and get out without overexposing yourself to COVID risk. Number two, for those people that are getting pregnant, which we're seeing a lot of, when they do go into labor, all patients currently in my community hospital are tested with a rapid test. For those patients that are either symptomatic, pending a COVID result, or the COVID result comes back positive, those women are treated as if they're positive until proven otherwise. They're also allowed to keep the baby in room with the patient after they're delivered. However, it is a community discussion that we have with the patient, that these are the risks with you being COVID positive. We assume until otherwise that your baby may be COVID positive. However, you have an option of rooming in because you're positive, or this baby will stay in the room at a 6 feet distance in an isolate. If she wants to breastfeed, options include pumping her breast, and studies are still not fully known about the transmission of COVID in breast milk or not, so that's still pending. But currently, they're saying these women can pump their breast, put it in a bottle, and if they can't physically feed the baby with proper mask, sleeve, hand washing, and give it in a bottle form, someone else, if they're there with them, can feed the baby. Or like one of my patients a few weeks ago had nobody to help, and there was one nurse assigned to help her and the baby in that room. She stayed in, delivered in that room, she stayed in that room, and she went home from that room 2 days later. So basically, everything was done within that environment, isolated, PPE protocols were in place. And she did fine, and the baby's doing fine till this day. For moms who are really sick and with COVID, and they just either delivered or had a baby, of course, those measures kick in place where the baby is separated while the mom is getting better, either in ICU, intubated, making sure she gets better as much as possible. And knock on wood, I haven't had anybody to get sick and die from COVID, but knock on wood.
Yeah, it's close. I mean, it is a tough decision. You guys are facing a lot, even just providing the services. Doctors, frontline workers are, they're talking about relief. There should clearly be a bonus for frontline workers post-COVID.
Yep, I have 3 kids. My son's a physician. My daughter's a third-year medical school student, and my other daughter is a third-year medical student. So they see a lot of it. So with all that being said, they have some loans that they have to work on after this is all done, but hopefully they'll get some relief and benefit from it.
So for all those that need to have insight, as a parent, how did you get 3 in the pipeline to assume the role or be a future Black doctor? Because there's not a ton of Black doctors.
My wife, give her the credit, Rosalind Morgan Turner. I was busy. I got there when I could, but she's the one who instilled in them the importance of education as well as I. And I didn't force the issue or didn't encourage it, or I told them, first of all, do something you love, and hopefully it all gets crazy sometime, but at least you should love it most of the time. Number 2, find something that can give you a comfort level, whether it be service to the community, service to yourself, service to your mind. Do something that brings a gratitude to your heart. My son decided he wanted to go into medicine. My daughter decided she wanted to go into medicine. The last one was deciding to go into law. And then when she went to her university that she went to, we're walking around doing the tour the spring before she started college. And she says, I'm changing my major. We're like, to what? And she's like, to pre-health. So she decided to go into it, and here we are, 2 in the 3rd year med school, and my son's a chief resident in his 3rd year family practice with hopes of doing orthopedic or sports medicine fellowship next year. So it's a blessing in disguise, but I give all kudos and support to my wife and her. Get out, sit down, take out your homework before you go outside and play, and then you can go and play. Back to elementary school. And that's what did it, I think. They have a good ethic in study.
So some of the myths about pregnancy in African American women, what are we facing? What myths do we need to overcome?
The myth that there's no help. There's a lot of help. We just have to go. People miss appointments. They don't keep their appointments. Prenatal visits are important because some people ask, well, why is it at the beginning every 4 weeks, then it goes to every 2 weeks, and then it's weekly? That's set in a design because when symptoms or problems start showing up, it's around that every 2-week visit and weekly visit towards the end. So if your blood pressure starts creeping up, we need to catch it before it's a problem. If your diabetes is out of control and you're gaining too much weight or spilling glucose and ketones in your urine, we need to catch it. So getting in and seeing your doctors on a routine basis is so key to keep those prenatal visits. And a lot of times we forget why we need to go to our doctor. It's not just to come and say hi. It's to monitor your blood pressure, your temperature, your weight, How are you doing? How is the baby doing? Documenting heart tones and making sure things are progressing like they should be. And if they're not, can we catch it before it becomes a problem?
So for those women who are literally going through and we hear about the infant mortality rate, what is that conversation like and what can we do as a community to change that?
Information, information, information. Be willing to talk about what do you do? Be willing to open up when you come into the doctor's office. Write down questions that you may have during the week. So when you do come in the office and we ask you, how are things going? Okay, let me take out my list. And you start asking those questions rather than, I'm fine. And then you leave and then, oh, I forgot to ask these questions. And then they get lost in translation down the line. So key thing for me is information, discuss, discuss, discuss.
You know, Doc, you make it seem simple, but for many, they may have never spoken to a doctor. So, what are the best methods for establishing a relationship? And then knowing when you really don't have one, so you seek another one. Because I think many of us stay the same place, get bad service, pay for the bad service, and don't know that we could really move.
Get better service.
Right.
One of the things that I look for, especially I had a patient today who met for the first time, and today was a busy day. And I could tell she was a little perturbed about the wait. So I walked in, I said, good morning, how are you? I apologize for running behind, but it's been a very busy day. I see that you're here for boom. How can I help? What's going on? But I could tell there was a stone wall that was first up when I started talking. And I allowed her the time to open up. Well, how long have you had this symptom? What do you think about this? What has been done before for this? Well, why do you think this is still happening over and over? After I went through all that, spent 35, 40 minutes with her, it was a joyful exit. And I could tell her needs were met because thank you, doctor, I appreciate it. I'm new to the area and I'll see you back in February for my well woman visit. Okay, good. We need to be observant, especially for our community, and getting them the time and the opportunity to open up and dig a little deeper as a healthcare provider by being observant for somebody who seems to be very quiet, not talkative, or they look like they're mad at the world. Open up and talk to them. Get them to open up to you. Ask them, are you okay? And wait with expectancy while you listen. Rather than, how are you, Mrs. Jones? Okay, great. Well, you know what? I'm going to see you in February. You have a good day. Have Merry Christmas. No. Give people time to be able to open up without rushing them in and out.
So, for that same question, weight, obesity, a huge issue. How do we begin? And obviously, you're saying women. Um, how do we begin to kind of like not fat shame and begin to address the issue that all of us don't have to be overweight? How do we begin to address that as a community?
As a community, health standards need to be educated, passed on, allowed to get into the groove of the conversation without letting people feel like they're embarrassed. Tell people I've lost 20 pounds over the past 2 years by stop going to places and getting a vanilla malt with dark chocolate and everything 3 times a week. Now I'll go twice a month as a treat. There are ways to enjoy things that we like without enjoying them every day, 3 times a day. we should be able to allow somebody who is having issues with their weight to verbalize, well, what are you doing? You know what? I want you to write down for the next week, next 2 weeks, everything you put in your mouth, and let me take a look at it. Email it to me so I can at least peruse through what you're doing. Because if I see you're eating too much of a certain thing at a certain time of the day, you know what? We need to cut that out. We need to minimize that. We need to make some basic changes. If you start doing all these different programs, diet pills, the surgeries, everything else, I always tell people those methods are like if you broke your leg, you're going to use what until your leg is healed? A crutch. A lot of those things are crutches. So until you change your eating habit, your exercise, and drinking water, once you throw that crutch away, if you haven't changed those other behaviors, you're going to gain the weight back.
So you're a true believer. You had a successful 20-pound loss. You didn't guilt yourself the first year that you didn't get to 20.
No.
So there's no rush, but there's a value in achievement. How do we get that message so that it's amplified throughout the community? I'm very, 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 very concerned that our community is not getting the insight from leaders that health is our number one priority coming out of the pandemic. And I'm not seeing any, obviously you gave me one with the vitamin D, but just no KPIs for what Black health must be 2021. And it doesn't, where can it be stamped in every church? Weight loss goal, the same methodology of a food journal just for 2 weeks so you can easily look at what you're eating. How can we reset? Because it does not seem as though I'm listening to everybody talk about the cabinet. I'm talking about the kitchen cabinet. What can you take out of the kitchen cabinet? How can you not buy cookies today? What is it? Don't bring things in your house, but just how can we have community set goals? I'm very disturbed that we have not set, and I say we, I will commit to interviewing again the doctor over the Black physicians just to see if we can come up with that, because I think there's a real issue with us not making our health priority number one, and people being excited about entrepreneurship, but then you have a stroke.
Right. I think one of the things that needs to go back to dissemination of information and how best to get it to our people. And if it's not going to be through mainstream media, then how? Does it have to be a rap song that is slowed down on the words to get the message across to our youngsters? Our leaders that are being elected need to step up and say more about the disparities, especially in the African American population, the access to healthcare. Some people don't have cars or gas money to drive to certain areas in order to get healthcare. If there's not public transportation, which costs, sometimes it makes it even harder. So we need to be able to get the message out either by social media, by information like this conversation we're having, and hopefully 5 million people are watching. And go to your doctor and talk to them about concerns that you have. Make a list. Don't just say, I'm here and I'm okay, when you may not be. Either be it mental, physical, welfare, social, talk to it. Because there are services out there that are available. The question is, how can we get access to it and find it?
Yeah. So I guess I'm going to go back to that. I need the top 5 health indicators that we need to address in 2021. So when people put that, and I would say on their refrigerator and on their mirror, they would be able to see what those top 5 are.
I'd start out with your mental health. Every morning I wake up, before I say anything else, I say to myself, thank you, Jesus. Then I say good morning. Number 2, to anybody I see near me, and like my wife, good morning. Then I'll start to have a conversation about anything else. So mental health is so important, because when your health mentally is stable, you can get through the day and the challenges that will come. Number 2, take your blood pressure medicine, hypertension, high blood pressure. That needs to be controlled. If it is not being controlled, talk with your healthcare provider about different alternatives. I saw my mom go through a lot of that. They put her on a lot of different medicines. I remember one they put her on. She woke up the next morning walking down a dark hallway. It lowered her pressure too much. Next thing I heard was boom in the hallway. No, that's not going to work for you, because that is too strong. There are alternatives to different types of medicines that can be utilized to control our blood pressure without leaving it too high or leaving it too low. Diabetes mellitus, sugar, whatever you want to call it. Technically, diabetes mellitus, adult onset especially, needs to be managed. You can enjoy your food without over enjoying the wrong stuff. And you can enjoy your food without over enjoying the wrong stuff. So mental health, hypertension, diabetes, prenatal care. We need to give our babies a fighting chance in this world, and they don't need to be held back because of lack of receiving services that ask for. Sometimes it's hard to get, I understand that, but ask for it. Every time people come to my office, if you don't have any prenatal vitamins, here, take these samples. That's why I tell the reps, I need samples to be able to give it on to my patients. So if they can't afford to buy it, at least they have multiple different choices of a prenatal they can choose from. Eat healthy, 2,200 calories when you're pregnant and breastfeeding, 8 to 10 glasses of water, get your rest. Those things are important for prenatal care. And number 5, I would say mental health, diabetes, high blood pressure, diabetes, prenatal care. After family care for the whole family needs to be maintained and monitored. Men need to go to the doctors too. We need to get in. We need to be seen. We need to get things checked. It doesn't make you weak if you go to your doctor. Go get checked, men. It can keep you healthy for your family. You can be the king and she can be the queen of the household.
All right. Yeah, and you said number 5 anyhow. It was exercise.
Exercise.
So those are the key, and we're going to come back to you because we're going to do the state of Black health during February, and we're really going to have an intense panel. So I'm going to come back to Doc so you can present that, because I think we're not looking at family history, which I would just add to the things that you're talking about. Knowing your family history is so important, and people just want to ignore it. He was crazy. No, he was depressed.
Mm-hmm.
I'm feeling and I'm snapping. Well, if you had an alcoholic dad and a domestically abused mom, you might have a few issues on why you snap now, why you get depressed, or grandma had sugar, your mom had high blood pressure and sugar. Might be close to you. You might want to pay attention to it. I'm sure family history has a role to play. The other thing is just the environment that you live in. How do we begin to change the environments that we're in so that there are places where we can mentally think about how to take better care of ourselves, remove old things, old habits out of the household, but just a range of a list that I think we need to figure out. Because when you say men, I think the other thing is women normally, and not all, at least talk about it. Men, you talk emotional, I love you, brother. They just what? Really? Why are you saying that to me, man? I mean, that's the immediate. And you're like, well, bro, if we don't have to talk emotionally, when you're having a problem, your anger gonna go, and I'm gonna be like, homeboy, I can't help you with that one. I think that the conversation of men just talking about good mental health, but just health in general. You know, you meet guys that are over 40 and they don't know what a PSA test is. You meet guys that are over 40, and when you talk about them and they say they have high blood pressure, they start talking about alternatives, and then you tell them, well, hold on, get it under control and then worry about the alternatives. Because most people don't talk about stroke. And I think that we're not really having conversations about stroke, yet the trauma of racism, economic despair are hitting our community, and we're really not articulating where we are. And then we don't take that high blood pressure, like you said, and then it's stroke. And I think that we see that way too often.
Yes. It is so important to have a conversation with your doctor. And don't just show up, pay your copay, let them do whatever, and then you leave without getting answers to questions that you may have. You need to get your questions answered. So my whole proponent is, especially as an OBGYN, but I also do weight loss management for men and women, is how best can you optimize yourself to be your best version of you?
Well, but here I am. I can't make it to Houston. I just need a few tips on how to at least address losing a pound a month for a year.
Drink water, 1,800 or less, 1,500 if you can do it, which includes eating breakfast, because the term breakfast is to break fast. Have a lunch, snack, dinner, and maybe even an evening snack. And get up and walk for 60 minutes while you look at a webinar or information Zoom conference. And if you do that 6 days a week for 60 minutes, 8 to 10 glasses of water, and eat, you should notice a change.
Well, it's the other thing I think that I have found, we call it the accountability brothers, but even having accountability partners, so that you and your exercise doesn't seem to be a figment of your imagination, but a figment of some peers. Because I think we don't have health peers. We don't have individuals that can really be on the journey with us. So that if you have a movement goal of 10,000 steps or 20,000 steps, at least there's someone who is in your life doing that. How important is it to have accountability partners as it relates to your health, weight loss, so that people know your goals and what you're working to eat differently?
Very important, because if you have someone on that journey with you, it makes it better, not only for you, but for them as well, and them for you. So it's a two-way street and a double-edged sword that can help facilitate everybody to get better. Nobody likes to do it by themselves, but you want to make it a habit, not a death penalty. So if you do what you're doing now and next summer you want to go on a cruise, when and if they come back, okay, before you go eat that big spread, go walk around the ship deck 5 times, go get on the treadmill for 60 minutes while you watch the ocean go by, and then you go eat you some food. But again, most people, if you go to a spread, everything you eat is not tasting like you expected it to look, or it doesn't taste as well as it looks. Don't eat it.
Right. And even the other tip that I've heard, and you can say if it's true, is drinking water before a meal, so that you can at least mitigate how much you all of a sudden feel like you need to eat. Is that true? Or
the theory behind that is, if you drink a liquid and you chew your food 30 times until it's really masticated, and then you drink a liquid afterwards each time, the signal that your stomach sends to your brain, your appetite center, it takes about 20 minutes, 30 minutes for your appetite center to say I'm full. Well, if you put water, chew food, swallow water, or some sort of liquid, even Crystal Light, something in your water, do that with your food, your stomach's going to stretch a little bit, not to the point that it stretches to now you can eat a whole Thanksgiving dinner, but it stretches to give that signal to the appetite center, I'm kind of full. But if most people eat lunch within 5-10 minutes of getting it. Your appetite center hadn't been kicked on until 25 minutes in theory. So drinking water, chewing, drinking water, chewing, drinking a liquid, chewing, those things can definitely help.
Food choices. What should we increase? What should we decrease? Because I think we're in holiday. Got to make some good food choices right now. Got to understand what to purge, what we should stay away from, do less of, stop justifying. What would be your top 5 to kind of like slow down on, and your top 5 to increase?
So it's going to be hard for me to stop because I don't really eat bad per se, I don't think. Fried food. I did have some fried chicken the other night and it was good, but I don't do that but once here and there, not every day. Baked is better than fried. Boiled fish is great. Your fresh vegetables. My mom was a health educator back in the day. She was one of those teachers that taught home economics, math, science, English back in the day. So when I was growing up, we had 5 different vegetables every day. And it was like, Mom, why we got to have all these vegetables? One of the things my wife did with the kids growing up, and she started introducing solids to them when they were babies. She started out with the vegetables. Then she went to the fruits and the sweets. Till this day, my kids eat all their vegetables. Brussels sprouts, asparagus, cabbage, mustard greens, collard greens, spinach. Those things are so important for us to have in the diet. So if we can go back to baked, fresh vegetables, drinking plenty of water, eating healthy as possible. Have fun sometime. We work too hard not to enjoy something we may like. But just remember, don't do that all day, every day, and then wonder why your pressure's off the wazoo, period.
I think the tip that you just gave us is, how do we balance our approach to food? I think that for me, what you're suggesting is that I don't feel guilty if I had a little fried chicken, but don't sign back up for that tomorrow.
Correct. That is so key.
I think the habits that we have, if you were given a speech at a med school, given what you know, what would you say the top priorities that they should know about the business and the commitment that it takes to deliver services, and how they could mitigate any of their cultural medical bias, given that audience typically would not just be an all Black audience?
Listen to your patients. Even if they're not physically talking to you, they are sending signals that they may need help beyond what they're verbalizing. And it takes a minute to understand that and learn that process, but I think we have it all within us to be able to look at someone and see something's not right, and how best do we get that person to divulge what they're feeling and wanting to say to us without making them feel weird in the process of doing it, or don't want to do it. That's one thing I would say to a graduating medical school. Be able to listen to your patient and see them. Try to understand their perspective on what they're dealing with. Just because they have an illness, that illness may be further mitigated by the lack of resources, the lack of fresh vegetables in their neighborhood, the lack of money to go to the store and buy things that we're saying you should be eating. Question is, Big Brother needs to step in and help us too when we need the help.
Yeah. Well, I want to thank you. It's been a phenomenal 50 minutes. We definitely need to come back to you for the state of Black health, because we really, and I appreciate that on diet. I really can't say how it's helped me just having this conversation, but I want our community to see from a physician who's committed to changing the lives. And congratulations on the 3 doctors. That's probably the biggest news I've heard this year on someone who's actually creating new ambassadors of health for our community, which is so badly needed, doctors of color in particular. Now all we need to do is send a couple of messages to CNN and some of the others that we want to see more doctors on TV that, have Turner as a last name. Thank you so much for tuning in and supporting Health IQ.
It is my pleasure, and thank you.
Thank you. Peace.